So the CANVAS study was a large cardiovascular outcome study of canagliflozin, which is a diabetes medicine, an SGLT-2 inhibitor, so an oral agent, and it was to meet the FDA requirement for safety, particularly relevant to this meeting, whether there could be replicated some of the heart failure benefits seen with the other SGLT-2 inhibitor study that's been reported out with empagliflozin. I think the take-home messages are that increasingly, even within the different diabetes medication classes, there are some drugs that have been shown to be helpful with respect to cardiovascular outcomes, some that have been neutral, and then there have been differential effects for heart failure, some that seem to improve things and some where there might actually be a signal of things getting worse. So I think trying to bring all this information together of how we actually help manage patients, I think the European guidelines for heart failure and some of the other guidelines nicely go through how we should approach this, of really using metformin as the first therapy, but now empagliflozin, and now adding the additional data from CANVAS that there also appears to be this benefit from heart failure hospitalization, although it wouldn't be, traditionally speaking from a statistical standpoint, it didn't meet the benchmark to say that there was superiority for heart failure. But I think bringing all this together, trying to make a complicated landscape simpler by looking at some of these different approaches as outlined in the guidelines and focusing on those therapies that are safe, but some that also may actually improve heart failure.